Human performance using diaphragm and transverse abdominal core control. When people start thinking of abdominal muscles, they usually think of the rectus abdominis muscle, which gives people that washboard-looking ab. But the most important abdominal muscle, which is often forgotten, is called the transverse abdominis muscle. This muscle wraps around and is your natural corset muscle that helps with stability and core control. Unlike the rectus, which is a vertical muscle, which is used for dorsiflexion, the transverse abdominis actually draws inward, creating inter-abdominal pressure that you can work against for core control in all of your movements. How we can activate this muscle is very simple. Picture your belly button having a string on the inside and trying to pull in the belly button to touch the anterior part of your spine. So it basically draws in your belly button and lifts up your chest at the same time. The second part of core stability is being able to use your diaphragm appropriately. Many people lose the function of their diaphragm and use their chest accessory muscles to breathe. The diaphragm increases the intra-abdominal pressure that the transverse pushes against, so it creates a solid bladder of air and core stability so that you can have levers to move against for good, powerful strength when you do lifting or anything else. So the activity is to pull in your belly button and still be able to use your diaphragm when you breathe. The last aspect of core stability is activation of the deep multifidus muscle in your spine. These are shoestring muscles that create extension of your lumbar spine, but they are not under active control. You can activate them secondarily by pulling in your transverse and using your diaphragm, but you cannot actively control and contract these muscles. So it's important to have the proper position because these muscles automatically kick on if the surrounding transverse and diaphragm and foot muscles, which we'll talk about in another segment, are activated. This then creates a solid core that you can use as a fulcrum to move against that is stable and is going to protect your spine. And if you repeatedly work on hollowing, using your diaphragm to breathe, and do this with movement, you will train yourself to use this activation system and have a very, very strong midsection.